Hi, welcome back to the Veterinary Technician Online Review course. We are working our way and finishing up Module 6.1, which is Common Diseases of Small Animals, and we are going to talk about musculoskeletal diseases. The first one we're going to talk about is very commonly seen in small animal practice is cruciate ligament injuries. So the cruciate ligament, as you can see here, is located in the stifle, and it is most commonly caused by injury. Two major types of cruciate injuries is a complete rupture, and the joint is now completely unstable, or a partial tear, where there's going to be instability. Most common in middle-aged, obese, inactive animals who hyperextend the stifle during exercise. Very common in dogs that do athletic activities like running, jumping, fly ball, all that kind of stuff. Clinical signs, they're going to be non-weight bearing on the rear leg, or walking on affected leg appears to cause a lot of pain. The tibia is going to rotate inwards. There may be swelling of the stifle, and it usually just happens out of nowhere. Just the owner says everything was fine. He was running around, he yelped, and now he's limping. That is often what happens. To diagnose it, we do what's called a drawer movement. So we actually take the tibia will slide forward in respect to the femoral condyle. So the doctor will actually take the knee and the hold in one hand the femur, the other hand the tibia and the fibula, and do kind of a rocking back and forth movement and see if there's too much laxity there. We could do a tibial compression test where the tibia moves forward, as above, when the hock is flexed. And we can take some radiographs as well that's going to show changes. And how do we treat it? We surgically fix it. Luxating patella. It's very common in dogs. There is medial luxation, which is the most common. This is common in toy, miniature, and large breed dogs. A lot of the time we see them in the smaller miniature breeds. Usually due to congenital abnormalities, and there's an increased risk of a cruciate rupture with these luxating patellas. You can also have a lateral luxation, which is very common in toy and miniature breeds, and a medial luxation as well, which any breed can have that one, which you can see in this picture over here. And with the lateral luxation, large and giant breeds, it usually happens at around 5 to 6 months of age, and it's usually bilateral, unfortunately, so both knees are affected. Occurs in the same breeds that are predisposed to hip dysplasia, actually. So with the luxating patella, you're going to have intermittent or sudden lameness of the hind limbs, can be unable to stand if both knees are affected. And they're going to have a very abnormal stance or gait. They're actually going to be knock-kneed or cow-hocked. So you'll see their knees kind of most of the time turning in towards each other. And the foot may twist laterally when weight-bearing. How do we diagnose it? We just palpate it. We may do some x-rays, and we fix it by benign neglect if it's not causing too much problems in these smaller guys, but typically surgical correction. Hip dysplasia, very common in large dogs, rarely seen in dogs that are under 12 kgs. Most large and giant breeds have a genetic predisposition to hip dysplasia. There is a severe form that is seen in puppies, but most dogs with hip dysplasia only start showing clinical signs later in life when chronic joint instability has caused joint damage, like degenerative joint disease. Then you'll start seeing the hip dysplasia. Risk of developing hip dysplasia increases with growth rate, so careful when feeding puppies. Clinical signs, they're going to have difficulty rising and stiffness that diminishes as the animal warms up during exercise. Pain on palpation of the dorsal pelvic area. Older dogs, they're going to be lame, waddling gait, and their thigh muscles are going to be atrophied. Young dogs that are severely affected may be reluctant to stand or move. How do we diagnose it? We do a physical exam and we also take an x-ray. The severity of dysplasia is graded on a scale established by the OFA. It ranges from excellent to severe dysplasia. This guy right here, I would say that he's got to be close to having severe dysplasia. I mean, this is the head of the femur, this is the acetabulum, and they're just not even in touch with each other. This one is, but there's definitely some abnormalities going on with the acetabulum here. So this guy's in pretty rough shape. And wow, look at the amount of poop in his colon. So I wonder if this guy is in so much pain and probably can't even walk, to the point that he's holding his feces and not able to defecate. Either way, we can treat conservatively with moderate exercise, weight control of the animal, and giving some anti-inflammatories, but there is surgical repair where we can do a femoral head ostectomy or a femoral head excision, femoral head and neck excision. And so this is basically where, and you can see in these videos, basically we'll surgically remove this right here. And then we just close the patient up, and then it decreases their pain, and almost immediately they'll recover very well, be able to walk. It's quite amazing how that surgery works. So dogs intended for breeding should have their hips radiographed after 2 years of age. Any dog that is registered with the CKC undergoes, I'm not sure if it's just dogs that are predisposed to hip dysplasia that undergo the hip dysplasia x-rays and they have to send it to the CKC before they're registered, or if it's any dog. The signs of hip dysplasia can develop early in the dog's life. It's very progressive, so the degeneration of the joint continues throughout the life. Weight loss and moderate exercise can really help the pet out. Puppies born to hip dysplasia-free parents may still develop hip dysplasia, so don't think that just because the mother and father are clear of hip dysplasia, they're 100% safe, because it's not like that. And surgery is the only cure. Panosteitis. So Panosteitis is a bone disease in dogs characterized by bone proliferation and remodeling. So something is happening with the bone. It's very painful, and it can last as long as 18 months. Though more commonly it lasts probably about 2 to 5 months. It's basically they're going to be lame, and it's going to come and go and changes from leg to leg. It's common in large breed dogs, usually starts at around 6 to 8 months of age, usually comes out of nowhere, acute, and it's more common in males. The cause is unknown, but we do suspect that it could be viral, and it can be accompanied with a fever, anorexia, weight loss, and reluctancy to move. It's a self-limiting condition, so episodes are treated with analgesia just to help with the pain and discomfort. Diagnosis is usually by radiograph, and you can see the change in opacity in the bone. So what we see right here, we're looking at a humerus, okay? And you can see the normal bone here and how abnormal it gets down here. And that's panosteitis. Tumors. No system is safe from the neoplasm. So you can have bone tumors. It's actually quite common, and it's very devastating because the prognosis is very bad and it progresses really quickly. Most common type is osteosarcoma. And 85 to 90% of bone cancers are osteosarcomas, and it's terminal in 90% of the cases, no matter what you do. The patients tend to be male, and they're about 7 years of age. It's very rare to have the osteosarcoma in cats. Treatment is usually to amputate and do some chemotherapy maybe. Any treatment tends to be palliative, so you just kind of take care of them until their quality of life is not good anymore, and then you would euthanize. Most of the bone cancers have already metastasized by the time we even know that there's a bone cancer, so very, very bad prognosis. Clinical signs: lameness, weight loss, pain over the affected bone, and you're also typically going to see swelling like you see in this picture here. Be diagnosed by taking a radiograph. A biopsy is usually required for definitive diagnosis, except for most of the time we don't go that route. The radiograph is pretty indicative of the tumor, and we know the prognosis is not good with osteosarcomas. And 80% of them, 80 to 90% of them are osteosarcomas. So we don't typically go through through the invasiveness of taking the biopsy. We just get our diagnosis from the radiograph. And we would also take a chest x-ray to see if this cancer has metastasized to the lungs, and this will give us an idea of how progressed the cancer is. I mean, if you have this little dog or this dog come in and you see a tumor like this on his leg, fine, let's talk about amputating it. But if we take an x-ray of the lungs and we see mets in the lungs, well, there's no point in taking off the leg and putting him through that, because the cancer has gone through his whole body at that point. So it's very important to do that and check for mets. Bone cancer is fatal. Basically, we just do some palliative care until their quality of life is no longer good. Usually they can live up to about 12 months of age. Amputation is required to remove the primary tumor, although be careful if it's metastasized, right? Drug therapy is very expensive, and dogs do very well with 3 legs. If the cancer hasn't metastasized, remove that leg, and dogs do very well with 3 legs. There's a saying in vet medicine that dogs were built with 3 legs and then they just have a spare. So go ahead and take it off. They'll do fine. And then the cancer will be gone. And this is just an x-ray here. You can see those arrows. The left one is a thoracic x-ray with no tumors, and the one on the right, the arrows are pointing to tumors in the lung. So this is what your thoracic x-ray would look like if there has been metastases.